lunch, or I listened to Nyle. And yeah, so today we have our own. They've been here way too many times. I probably can't even count how many. So, Cynthia, Nyle, thank you guys so much. And I'm gonna say a word. Oh, so who goes first, Cynthia or Nyle? I think Nyle, right?
No?
So I just want to say that personally, well, I'm a guy, right? So I don't really fully understand the women's pelvic floor issues problems. But I will tell you that over the years, I find that people like Nile are probably most important um, part of your team if you have any pelvic floor dysfunction, because the reality is medical healthcare system completely unable to take care of most of pelvic floor problems. You really need a very good body worker, and it doesn't even matter exactly what they do. They just need to do it well and work with you continuously. These problems tend to often be pretty chronic, to my knowledge. So with that, Niall, thank you so much. Welcome back. Welcome you here.
Thank you.
Take
Thank
it from
you.
there.
And you're right, I do always run over. I'll try not to do that. It will be. Fundamentally, my role is to get you all up. So whenever you see me on the mindfulness experience, know that you're going to be moving. And that's honestly the biggest issue. Well, one of the biggest issues with chronic illnesses as we age is it's a stagnation issue. So what have we been doing over the past couple years? We've been sitting in front of screens probably more than ever. So I'm sure there's a correlation with your chronic pain and that. And dysfunction in the pelvic floor is no different. I really want you to look at this as just a piece of the whole puzzle. My job is to convince you that everything is connected, nothing is separate, both inside the body and outside of the body, as within, so without. So how we function physiologically informs our behaviors. So if you kind of take it down to a more micro level and just say I'm going to be focusing on the pelvis, let's talk about pelvic dysfunction. Raise your hand if you know you have any sort of pelvic dysfunction or pelvic issues. Okay. Raise your hand if you have digestive issues. Then you have pelvic floor dysfunction. Raise your hand if you have issues with breathing. Then you have pelvic floor dysfunction. Raise your hand if you have issues with jaw tension and pain, TMJ, grinding your teeth, low grade tension headaches. Then you have pelvic floor dysfunction. So that is how connected this is. That's how important it is. So I'm going to give you a few tips today, and I'm going to try not to lecture you too much on the why of it. I will say to you, if you raised your hand, I highly recommend seeking out a pelvic floor specialist at some point. My information is always in the replays of this. So you can start with me, we can have a conversation, and if I don't have availability, I can refer you to someone. There are a lot of pelvic floor specialists in the DMV area, and we love to refer to each other. So you'll have the help you need if you feel you need it. So the typical reasons why somebody would come to a pelvic floor therapist is if they're having incontinence, right? Incontinence or pain, pain with sex are usually the two reasons why someone would come to a pelvic floor therapist. Also, if you have a prolapse, and if you don't know what a prolapse is, that's basically where one of the organs in the pelvis kind of starts to sag and sink into the bowl of the pelvis. So I'm going to briefly share with you my screen and show you what the pelvis looks like, just so that we're all on the same page here. So this is a software program that I use for teaching called the Human Anatomy Atlas. What this is showing you here is all of the cardiovascular, vascularization, the lymphatics, and the nerves that run through the base of the pelvis. How amazingly complex is that? And then inside of the pelvis, you can see this is the anatomy of somebody assigned female at birth. Usually they identify as a woman. So what I want you to see here, and I'll try to make it a little bigger, is just the organization of the organs, because I do get this question often. The first organ here is the bladder. The second organ here is the uterus. So even if you no longer have a uterus, if you had one and it was removed, just know that this is the organization of the tissue. We cannot have negative space in the body. So if this organ ends up getting removed, then all of the organs above it start to push down and fill that space. And fundamentally, that's what a prolapse is when either of these two organs or the rectum in the back, which isn't featured here, starts to push down into the bowl of the pelvis. And it can even come out through the vaginal or rectal opening in the bottom here. So that's what I mean when I say a prolapse. How can you address these things? Oh, and I also want to mention low back pain is absolutely an issue of pelvic floor. It's pelvic floor related. So those are all different reasons why you may want to seek out a pelvic floor specialist who does body work, specifically someone who understands the connection fascially. So what can you do if you have any of these symptoms? Well, it always goes back to release the restrictions first, okay? I see your question here. Release before you strengthen, and that is not something that all therapists do. So even therapists who specialize in pelvic floor dysfunction, they may not necessarily work with you to release the restrictions first. Why do we need to release first? Because of something known as the length to tension discrepancy. So I have my little pelvic floor diagram here. I don't know why because I covered my face. My camera wants to see my face. So when we're working with somebody as a pelvic floor therapist, we want to release where the restrictions exist in the base of the pelvic floor first. So from that diagram I showed you, this is the position of the pelvic floor. It's a bowl and it's holding all your organs. So when you're working with a pelvic floor therapist, they're going to release the restrictions in the tissue here in order to take the tension out of the pelvis. When you release the tension, let's say there's tension over here in the back, sort of by the left hip. This is upside down. In the back, sort of by the left hip, this is the sacrum. So let's say you have some pain and tension here. A pelvic floor therapist is going to go in intravaginally or intrarectally and release those restrictions there. You can also work from the outside in, so you can press down into the tissue there. And with slow sustained pressure over time, you're going to release the restriction, and that allows the tension to be released from the pelvic floor, allowing it to sit like a bowl again. And that's often why the prolapses happen, is when there's a restriction, this bowl isn't evenly dispersed, and there's weak points in the floor of the pelvis. Now organs can start to prolapse through those weak points. So if you're seeing a therapist and they're going right to strengthening first and not releasing, that's a little bit of a red flag, and you're going to either want to ask to work with somebody who does release techniques too, or see if that therapist will do that with you first. So release first. I'm going to show you a release technique you can do on your own. But before I do that, I want to talk to you about the second phase of what you want to do. Before you go to exercises, there's still a step in the middle you want to do first, which is breathe. I know, y'all are like, yeah, easier said than done. Breathing is so important, you all. How many of you are holding your breath right now as you're watching this? The reason breathing is important is because the respiratory diaphragm affects the pelvic floor. Basically, when you breathe, the respiratory diaphragm goes up and the pelvic floor tightens. And then as you breathe out, the respiratory diaphragm sinks down and the pelvic floor relaxes. So there's this kind of syncing up that happens between the respiratory diaphragm and the pelvic floor. Additionally, you need that action in order to massage the organs inside of your body and keep the pelvic floor toned. So there's this really great technique called the core breath that I want to show you today as well. So first I'm going to show you how to release organs in the abdomen. Then I'm going to show you how to bring in or recruit the breath. And then the last thing you want to do is exercise. All right, so Kegels are not the go-to answer for pelvic floor dysfunction anymore. They're the last step, and it's only because the body is now ready to receive strengthening. So I will show you kind of a Kegel, but it's more of a functional Kegel. So I'll show you that at the end, combining it with a squat. And then I'll leave you with some really great resources that you can start on your own. And if you still feel you need a therapy referral at that point, reach out to me. All right. So release, breath, strengthen. Before I get into those three, I want to show you why breath. I have this really fascinating video. And it's unfortunately, I can only find it on Facebook here. So I'm going to show it to you on Facebook. But the company is Stockbridge Osteopathic Practice, and I think it's in Sweden. They were able to capture an image of the breath. So I'm going to play that for you now. Just take a minute to watch this. It's about 17 seconds. I'm going to stay quiet and we can just watch it on repeat. So the in breath, the out breath. In breath, out breath. And this person's breathing rather fast. It's not ideal. But this is what's happening inside of your body as you're breathing. The organs are massaging your abdomen and toning the base of the pelvic floor. And if you are restricted, you can't recruit the breath. So that's why release first. With the breath, not all breaths are created equally, and we've had lots of practice with the breath in these mindfulness experience journeys. We've had breath workers on here. We've had people talk to you about breathing. But when it comes to pelvic floor work, you really only need one type of breath, and that is known as the core breath. So I'm going to teach you the core breath today as a takeaway to help you start to tone the pelvic floor and bring back function in this natural rhythm. And then before I wrap, I'm going to show you a release technique that involves a squat. So if you're in a space where you can stand at the end, please join me. If you're not in a space, go ahead and move to a space where you'll be able to stand when we get into that part. And also, if you are able to lie down for this first part, when you're recruiting the breath, it really helps to lie down. All right, so with that said, no more lecture. I am going to stand up, and if you would like to join me now, please stand with me. Except for you, Misha, keep eating your lunch. Let me adjust this a little. Okay, apologies, I lost video connection and now my screen is going haywire. Okay, here I am. Okay, release, breathe, strengthen. To release, if you have some sort of small ball about this size, it's about 5 inches round in diameter and air-filled and squishy. If you've worked with me before, you probably have one of these. If you don't have one of these, you can take some washcloths, like 2 washcloths, and roll them up and tie a rubber band around them. It'll become about this size. So what is this ball for? We use this ball to release restrictions in the abdomen, and in doing so, it helps us to recruit our breath. For pelvic floor, for releasing the pelvic floor specifically, I do recommend seeing a pelvic floor therapist for that. That's not something I'm going to teach you today, but this is absolutely something you can start to do today. So to release the abdominal muscles, you're going to take either a ball like this or a couple washcloths and find a tender spot either to the left or the right of the belly button, above the hip bone and below the ribs. So stay off of bone for this. And then all you're going to do is lie down either on a yoga mat, on the floor, or even on your bed. So you'll find a spot in your abdomen and lie down on the ball, starting propped up on elbows and connecting with the pressure of the ball. If it feels tender in here, it means you need it. If it doesn't feel tender in there, roll off the ball a little and go a little higher or a little lower and see, or a little more into the belly button. All of this tissue is fair game. You have quite a few natural girdles or protection to your vital organs. So if you're just using an air-filled squishy ball or some washcloths, it's not going to hurt to do this. And you don't need to find a specific area. Just look for something tender. You don't need to know what it is necessarily. That's why this is a really great kind of foolproof thing for me to teach you now to start the release process that will have a direct effect on the pelvic floor. So when you find a spot, then you can start to lower down onto your hands and breathe into the ball. Release for about 5 minutes on one side, then come up, roll away and move it to the other side and do about 5 minutes on that side as well. My left side is my tender side, so I'm not going to be able to breathe to talk while I'm doing this. So I won't stay here long. But after you do about 5 minutes on one side and 5 minutes on the other side, then you can come up on the hands and knees and push yourself back into a child's pose position. And if your knees can't handle that, then come up on the hands and knees and do a couple cat-cows. Round your back, arch your back, pairing it with your breath, which brings me into the second thing. So the core breath. The core breath, there's a great video of the core breath, and I'll type into the chat the resource for this. But Kim Vopni has on YouTube a whole channel dedicated to the core breath. So if you're interested in this, go on YouTube, search her up, and she'll guide you through the core breath technique. So all the core breath is bringing your attention and focus into the natural expansion and contraction of the abdomen as you're breathing in and out. And if you're in a space to do this lying down, I would like for you to do this with me lying down. And if you're not, you can do it with me sitting up. So go ahead and find the space where you'd like to do this. And then once you're in the space where you're going to be focusing on your breath, tune into your breath for a moment and just take a natural breath in and out and count the number of seconds you were able to breathe in and out. And that's going to be your baseline. So if you're only breathing in and out for 4 counts, that's a pretty shallow breath. That might be where you need to start, but I do encourage you to try to work up to 5, 6, 7, or even 8 seconds in and seconds out. And for the core breath, it's an even count in and an even count out. The focus is not on the count, it's on what your abdomen is doing. So for the core breath, place your hands on your abdomen, and I want you to breathe in and feel your belly rise for the number of seconds that was your baseline, let's say 5. And then on the out breath, feel your belly fall for 5 seconds. So let's just do that a few more times. And notice if you're now able to start to breathe in for 6 or 7 counts or 8 counts. If you're able to, now that you're connecting with your breath and your nervous system is turning off, I want you to breathe in and out for that count, the maximum count you can. And if you're lying down, you can get a better sense of this. So I'm going to go ahead and lie down now because there is one more piece attached to this. If you're not lying down and you'd like to join me, now's the time. So lie back with your feet flat on the floor and your knees bent. and place your hands back on your belly. So let's go back to whatever your count was. Let's say your count is now 6. And go ahead and breathe in for 6 counts, feeling your belly rise. And breathe out for 6 counts, feeling your belly fall. Now that you've kind of got the hang of this, there's one more part to it. Remember, this is pelvic health. So as you're breathing in, your sacrum will also extend back into the floor if you're lying down, or back in your chair if you're sitting. As your belly rises, your sacrum extends back. I'm going to exaggerate it so you can see. And as your belly falls, your sacrum flexes under. So it ends up looking like this. So that's the core breath. It should be intuitive, but this is actually what we call in pelvic health world down training, because oftentimes we don't have access to the core breath because we're restricted somewhere, or because we're overly tight in the pelvic floor, that link to tension discrepancy I talked about. So usually we need to go back to the breath and retrain the body how to breathe in with the belly rising and the sacrum flexing or extending, and breathing out with the belly falling and the sacrum flexing. So it looks like a natural rhythm of the body. And then once you have kind of recruited the breath again, or come back connected to the breath again, then you can strengthen. Now, if you're down on the floor with me already, there's a really great, very basic exercise you can do from this point, which is just bridging your bottom up and back down. Now, when you do this, though, in order to recruit the pelvic floor muscles, you want to bring your heels hips distance apart, squeeze between your inner thighs as if you're squeezing a ball. And in fact, if you have your little air-filled ball, you can just place it between your legs at this point, and then slowly bridge up and hold for 4 to 5 seconds, and then slowly lower back down. So do about 5 to 10 of those, squeezing between your thighs, bridging up and holding for 1, 2, 3, 4, 5, and then lowering back down. Taking a break, maybe do a core breath here, and then bridge up again. Hold it for 1, 2, 3, 4, 5. And another really great tip here is if you push from your big toes, that automatically makes you squeeze your inner thighs, and then down. So you will do that for a total of 5 times, holding for 5 counts, working your way up to 10. So between those 3 different things that I taught you, that's kind of a great little starter routine, I feel like. But I'm going to type into the chat, once we hand it over to Cynthia, some resources for you as well. I'll give you resources for Ken Vopni for that core breath if you need more guidance. And I'll also give you a resource for pelvic gym. So if you want more exercises aside from that very basic one I taught you, pelvicgym.com or pelvicgym.co, I think it is, has some really great like freebies to get you started. And then it's a membership service if you want to keep going. And lastly, I'll put into the chat a resource for the Art of Control, which is a women's guide to bladder control for those of you who are needing a little bit more incontinence resources right now. Okay. Can I just check the chat really quick?
Yeah, there are 2 questions that I think you may want to answer. First of all, how the VM therapist is different from pelvic floor specialist, and also the breathing during breathing.
Thank you. Yeah, it's not different. Well, it is and it isn't. A visceral manipulation specialist can do Let me see if I can bring my camera down without losing you all again. A visceral manipulation specialist can do pelvic floor work, and that they are releasing those organs, right? And now you know that is so related to pelvic floor work. So you can get really great work done with a VM specialist. You need info on the ball. You can, if you go to BlueNyleTherapy.com under my resource page, at the bottom, I actually have links to different tools that I use in my workshops, and the ball is one of them. I have a ball on there. What is the breathing doing while you are bridging? Oh, great question. Because oftentimes we're holding our breath when we're working, right? So when you're breathing, pair the out breath with the work part. Okay? So as you bridge up, low out. Pair the out breath with the work part. And then during the rest break, maybe take a core breath and then go into the second step, the second repetition. Okay, yes, and I'm going to put the resources that I just mentioned in the chat right now, so you'll get access to those. All right, thank you, everyone.